Selamat siang, Bapak Ibu sekalian. Selamat datang di Indonesia OECD Joint Webinar Cities and COVID-19 Indonesia's Response. Izinkan kami dari Organizer Bahasa Global untuk memberikan panduan singkat mengenai penggunaan fitur Zoom di dalam webinar siang hari ini. Allow us, as the organizer for today, please give us the opportunity to briefly let you know regarding how to use the Zoom interpretation in this webinar. Um, and most importantly is for you to use the latest updated Zoom application to access the interpretation feature. Dan kami juga dalam hal ini yang paling penting adalah Bapak Ibu diharapkan sudah menggunakan aplikasi Zoom versi terkini supaya dapat mengakses penerjemahan secara simultan di sepanjang webinar siang hari ini. Kita ada penerjemahan secara simultan bila Bapak Ibu menggunakan PC ataupun laptop, maka di sebelah kanan bawah layar ada icon bola dunia, mohon diklik dan dipilih bahasa yang ingin didengarkan. Silahkan memilih English untuk mendengarkan dalam bahasa Inggris dan dapat memilih Indonesian untuk mendengarkan dalam bahasa Indonesia. Kami menyarankan untuk tidak perlu Bapak Ibu memute original audio. So distinguished guests, ladies and gentlemen, if you are using PC or laptop this afternoon, you can access the simultaneous interpretation throughout the webinar. On the bottom right of your screen, there's a globe icon. Please click and select the language that you wish to listen. You can select English if you would like to listen in English the whole time, or Indonesian to listen to Bahasa Indonesia. And we also kindly advise you to not mute the original audio. Bagi Bapak Ibu yang mengakses webinar ini menggunakan handphone, tampilannya akan sedikit berbeda. Di layar utama aplikasi Zoom di handphone akan tampak seperti di layar. Di kanan bawah ada 3 titik, diklik dan dipilih language interpretation dan dipilih bahasa yang ingin didengarkan. Terakhir jangan lupa untuk klik done bila sudah selesai. And for those of you accessing the webinar using a mobile phone, it will show slightly different on your phone. On the main Zoom apps of your phone, there will be 3 dots on the bottom right of your screen. Please click and select language interpretation and select the language that you wish to listen. And lastly, click done to activate. Dan terakhir, guna memastikan kelancaran pertemuan hari ini, host dan co-host berhak melakukan mute audio dan bahkan men-stop video para panelis yang tidak sedang berbicara bila tanpa sengaja menyebabkan gangguan terhadap acara ini. Ini dilakukan untuk menjamin suara pembicara dan juru bahasa tetap jelas. Ladies and gentlemen, just a disclaimer, please note that to ensure the smooth running of today's meeting, the host and co-host reserve the right to force mute the audio or to turn off the videos of the panelists who are not speaking. That may be unintentionally causing disruption to the meeting. This is to ensure that the audio of the speaker and the interpreter remains clear at all time. Terima kasih banyak atas waktu Bapak Ibu sekalian. Selamat berkegiatan. Have productive webinar. Kami kembalikan kepada MC.
Assalamualaikum warahmatullahi wabarakatuh. Yang terhormat Bapak Rudi Prawiradinata, Deputi Menteri Perencanaan Pembangunan Nasional, Kepala Bappenas Bidang Pengembangan Regional. Yang terhormat Mr. Nadiem Ahmad, Deputi Direktur OECD Center for Entrepreneurship SMEs Region City OECD. Dan yang saya hormati seluruh pembicara, tamu undangan, dan seluruh peserta yang berkenan hadir dalam kegiatan webinar ini. Selamat siang dan selamat datang dalam Indonesia OECD Joint Webinar Cities and COVID-19 Indonesian Response, Kamis 17 Desember 2020. Webinar ini diselenggarakan atas kerjasama Kementerian Perencanaan Pembangunan Nasional Bappenas Indonesia, dengan The Organization for Economic Cooperation and Development (OECD) untuk memperkaya pengetahuan mengenai strategi pemulihan pasca COVID-19 baik di tingkat internasional, nasional, dan daerah, serta untuk membangun perkotaan Indonesia yang lebih berkelanjutan. Dan sebagai informasi kepada Bapak Ibu juga dapat menyaksikan kegiatan webinar ini melalui siaran langsung pada YouTube channel Bappenas. Baik, Bapak Ibu hadirin, sebelum kita memulai kegiatan webinar pada hari ini, pertama-tama kita akan mendengarkan sambutan pembukaan. Yang pertama adalah sambutan dari Bapak Deputi Menteri Perencanaan Pembangunan Nasional, Kepala Bappenas Bidang Pengembangan Regional. Kepada Bapak Rudi Prawiradinata, kami persilahkan.
Baik, terima kasih Mas Dio. Bismillahirrahmanirrahim. Please allow me to speak in Bahasa Indonesia, as I know that we have two translators, so I will optimize them. Thank you. Yang terhormat, Mr. Nadiem Ahmad, Deputy Director OECD Center for Entrepreneurship, SMEs, Regions, and Cities OECD. Para panelis, Professor Brian Robert, Canberra Urban and Regional Future from University of Canberra. Nice to see you too. Pak Dodi Ruswandi, PLT Deputi Bidang Penanganan Darurat, Badan Nasional Penanggulangan Bencana. Actually, he's my boss. Since we graduate from the same university and same department, and he is my senior, so I always call him boss. Up until now, I still call him boss. Ibu Soeharti, Deputi Gubernur DKI Jakarta, Bidang Pengendalian Kependudukan dan Permukiman Provinsi DKI Jakarta. She is my best friend too. Actually, we still need her in Bappenas, but she preferred to work for governor. So I hope someday.
Pak Deputi mute.
Ya, oke. Pak tentunya moderator Pak Mulya Amri, I know him well as well. He used to work with me, I think sometimes ago. Tentunya para tamu undangan dari Kementerian Lembaga, Pemerintah Daerah, Mitra Pembangunan, dan Universitas, serta hadirin yang saya hormati. Assalamualaikum warahmatullahi wabarakatuh. Selamat siang dan salam sejahtera untuk kita semua. First of all, pertama-tama saya ucapkan terima kasih kepada Mr. Nadiem Ahmad, Deputy Director OECD Center for Entrepreneurship, SMEs, Regions, and Cities OECD, atas kerjasamanya dalam penyelenggaraan webinar ini. Tentunya kita harapkan ke depan kerjasama ini terus bisa terjalin dalam lingkup yang lebih luas lagi. Terima kasih saya ucapkan kepada para panelis dan juga para moderator yang telah hadir di sela-sela kesibukannya. Saat ini di bulan Desember ini banyak sekali kegiatan dan tentunya saya sangat apresiasi dengan para panelis, moderator yang sudah berkenan bergabung bersama kita. Bapak Ibu peserta webinar, isu perkotaan adalah kawasan yang terdampak cukup signifikan oleh pandemi COVID-19 ini. Dengan 90% kasus berada di perkotaan secara global. Jadi memang kalau kita lihat dampak COVID ini dibandingkan dengan di pedesaan, di kota itu sangat signifikan. Mungkin karena juga lingkupnya lebih padat dan lain-lain. Di Indonesia, tren infeksi COVID-19 masih terus meningkat dengan angka mendekati 600.000 kasus dan angka kematian yang telah melampaui 18.000 jiwa. Dampak pandemi juga sangat besar pada kondisi sosial ekonomi Indonesia yang mengakibatkan peningkatan jumlah pengangguran serta peningkatan jumlah pekerja yang beralih ke sektor informal. Di sisi lain memang dampak ini sangat berdampak kepada sosial ekonomi, namun sebetulnya di sisi lain juga ada opportunity lain yang bisa kita optimalkan. Apalagi kita tahu bahwa COVID-19 ini tidak akan hilang begitu saja, tapi kita harus membiasakan diri hidup bersama dengan kondisi COVID, mungkin sama dengan flu sekarang.
bisa kita bisa menanganinya dengan baik dengan berbagai treatment atau obat tertentu. Jika kita mencermati penyebaran kasus secara nasional di Indonesia, perkotaan menyumbangkan angka rata-rata kasus yang lebih tinggi per 100.000 populasi dengan konsentrasi di kota-kota besar berpenduduk lebih dari 1 juta. Ini saya rasa Ibu Harti mengetahui persis kondisi ini karena Jakarta juga sekarang mau harus sudah terlalu banyak yang merah pekat ya Bu Harti. Angka total kasus di 8 wilayah metropolitan juga berkontribusi terhadap lebih dari 50% kasus di masing-masing provinsi, sehingga semakin menunjukkan fakta bahwa perkotaan dan lebih khususnya di wilayah metropolitan menjadi epicentrum COVID-19. Para hadirin yang saya hormati, ada sejumlah penyebab yang membuat perkotaan memiliki kerentanan yang cukup tinggi. Salah satunya adalah karena belum terpenuhinya layanan dasar perkotaan seperti perumahan yang layak, air minum tentunya, sanitasi, dan transportasi umum. Jadi ini memang kalau di perkotaan menjadi sangat signifikan, terutama transportasi umum, perumahan yang kumuh, yang contoh di Jakarta yang dekat paling tidak dengan tempat tinggal saya di Jakarta, itu juga masih banyak di sekitar-sekitarnya yang rumah-rumah kumuh. Nah ini tentunya juga menjadi salah satu penyebab kenapa begitu tingginya COVID-19 ini. Rumah dan permukiman yang sehat adalah tempat yang teraman untuk melindungi kita dari pandemi. Tempat aktivitas harian utama dilaksanakan seperti sekolah bagi anak, tempat bekerja, dan juga tempat melaksanakan aktivitas sosial yang sekarang sangat umum dilaksanakan secara daring. Jadi ini untuk menghindari ini ya tidak mau harus dilaksanakan dengan daring. Belum bicara mengenai transportasi publik yang tentunya juga sangat rentan terhadap COVID ini. Namun tidak semua penduduk perkotaan Indonesia tinggal dalam kondisi yang aman. Nah ini tadi saya katakan di depan. 20% penduduk perkotaan tinggal di permukiman kumuh dengan kepadatan tinggi tanpa akses yang memadai pada air minum dan sanitasi aman serta fasilitas kesehatan yang cukup. Bagi komuter yang beraktivitas di perkotaan, layanan transportasi publik belum cukup aman dan belum dapat menghindarkan para komuter dari kepadatan dan dalam perjalanan di tempat kerjanya. Jadi ini juga beberapa isu yang tentunya menjadi concern kita semua. Bapak Ibu peserta webinar, perkotaan yang berkelanjutan perlu memenuhi sejumlah kriteria yaitu adil, inklusif, berbudaya, maju, menyejahterakan, hijau tangguh dengan didukung tata kelola yang transparan, akuntabel, cerdas, dan terpadu. Saya akan menggarisbawahi tentang prinsip cerdas ini. Di awal pandemi, kita banyak mendengar distance is back. Pandemi menyebabkan kita harus melakukan social distancing, bahkan physical distancing. Juga pembatasan perjalanan. Namun dengan penerapan prinsip cerdas, kita bahkan bisa dengan mudah bertemu secara daring dengan Bapak dan Ibu dari bagian dunia lain, dari zona waktu yang berbeda. Seperti kita dengan Pak Tadasi, I know that you are in Paris, I guess. Kita dapat membuktikan secara langsung dengan layanan yang tepat, bahkan dalam masa pandemi kita dapat berbagi pengetahuan dan tetap dapat produktif. Jadi ini salah satu hal yang mungkin efek positifnya, kita mudah berkomunikasi dan lain-lain secara virtual. Pelaksanaan prioritas pemerintah di tahun 2021 tercantum dalam rencana kerja pemerintah tahun 2021. Harus memanfaatkan dukungan prinsip cerdas ini. Tujuannya adalah agar seluruh agenda percepatan pemulihan ekonomi, terutama reformasi sistem kesehatan nasional, reformasi sistem perlindungan sosial, serta reformasi sistem ketangguhan bencana dapat dilaksanakan dengan lebih efisien, dengan penggunaan teknologi secara tepat, terstruktur, dan terintegrasi. Jadi ke semua reformasi ini sebetulnya arahan dari Bapak Presiden yang sebagian besar ditugaskan kepada Bappenas untuk disiapkan reformasi ini. Jadi ini PR yang besar karena ke depan bencana non alam ini harus menjadi rujukan juga. Kita menyadari kesiapan dari sisi kesehatan pun perlu terus diperkuat. Hadirin yang saya hormati, sebagai penutup dapat saya sampaikan bahwa solusi konvensional tidak dapat memecahkan permasalahan kota yang semakin kompleks. Pandemi COVID-19 ini telah menjadi momentum percepatan upaya kita mewujudkan perkotaan yang berkelanjutan. Hadir bersama kita hari ini sejumlah panelis dengan kompetensi yang luar biasa. Tentunya kita harapkan masukan-masukan dari para panelis ini. Saya berharap kita bisa belajar bersama, berbagi pengalaman, bukan hanya satu arah dari pembicara kepada peserta, namun juga sebaliknya melalui forum tanya jawab. Dari forum kita juga bisa mengambil manfaat dan mengimplementasikan di tempat kita berkarya untuk bersama-sama bangkit memulihkan kondisi perkotaan di Indonesia. Demikian yang bisa saya sampaikan pada siang hari ini. Selamat berdiskusi dalam webinar ini. Saya juga sekali lagi saya ucapkan terima kasih kepada semua panelis, kepada moderator dan para hadirin yang sudah berkenan hadir pada siang hari ini. Demikian saya sampaikan. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih kepada Bapak Rudi atas sambutannya. Untuk selanjutnya akan ada sambutan dari Deputy Director OECD Center for Entrepreneurship SMS Region NCT OECD. Kepada Mr. Nadim Ahmad, time is yours.
Thank you, Mr. Dio. And Honourable Deputy Minister, distinguished guests, ladies and gentlemen, good morning, good afternoon and good evening. A phrase is becoming increasingly normal in today's virtual reality. Let me begin by saying what a pleasure it is to be able to join you here today, I mean, even if only virtually, for this important event to discuss the impact of COVID-19 on cities and how we can channel them to build back better. And let me also extend my gratitude to the Deputy Minister for his excellent speech. I think it really sets the scene for the discussions that we're about to have. And of course, my infinite gratitude to Bapinas for co-organising this event with us. Now, no speech today starts without a reference to COVID. And of course, especially given the title of this particular webinar, my speech will be no different in that respect. But it is important to recall that even before COVID struck, the cities were already on the front line of many pressing global challenges: globalization, digitalization, aging, migration, climate change, and environmental degradation. And I'm sure there are many others that could be added to that list. Now, confronting these megatrends was already front and center of our policy lens before COVID. And COVID has sharpened and heightened the focus, whilst also bringing with it many new challenges, even if only short-term. Now, short-term challenges, I hope, especially now that we have so many vaccines in production, that were related to managing the immediate health crisis and implementing policies to contain the spread of the virus, such as lockdown measures, which we've seen in hundreds of countries around the world, and they've become a frontline tool for many. And this is likely to remain the case despite the arrival of new vaccines for many more months to come. And of course, there are many short-term challenges that are needed to protect the health of the economy and people's income. But even these short-term challenges will have longer-term consequences, for example, in government debt, firm solvency, employment, with tens of millions out of work, and of course on future growth as the impacts of the financial shock begin to unfold. The stalled investment that we've seen from many firms will have a lasting effect, as indeed will, of course, the impact on employment as people start to shift from basically places they used to work to others. We may end up creating new types of skills gaps. Now, beyond that, however, the challenges we faced before the crisis will remain the same challenges that we will need to confront going forward. Now, I say the same, but what I actually mean that it's even more important than ever that we confront them. One of the most important lessons that we've learned from the crisis is that building back better really isn't a choice. In the same way that we learned that the short-termism that led to the last financial crisis needed to be tackled to mitigate the risks of financial contagion, we've also learned through this pandemic that the costs of not being resilient can also be extortionate on people and on the economy. And we have a much better appreciation today that the way that we think about resilience has a spatial dimension, as was well illustrated by the Deputy Minister. And this requires targeted, but also sometimes differentiated responses. And our work at the OECD indicates that COVID-19 is having strong asymmetrical impacts across spaces, meaning that we are now much more aware than we ever were that the way that we plan, manage, and organize our cities is key to dealing with those impacts. Impacts that have a direct bearing on people's health, quality of life, and of course, the strength of our economies. We know, for example, that increased air pollution in cities exacerbated people's vulnerability to the virus, which has helped strengthen momentum around a problem that we have long known needed to be tackled. Increased air pollution has always had a cost on health, and indeed on public finances, through the provision of health services. But we know now, like the polluting emission particles, that those costs are not invisible. Indeed, only yesterday, and sadly, a young 9-year-old girl in London was confirmed in a landmark ruling as the world's first person to have air pollution listed as the cause of death. And the scale of problem is huge. Many cities still have exposure levels above the recommended limit. 30 OECD countries indeed have at least one city with air pollution above recommended levels. And air pollution continues to rise in low, middle and low income countries. As our work has shown, the crisis also highlighted and indeed it exacerbated the deep inequalities in our societies. It's hitting the most vulnerable the hardest, those who live in inadequate housing conditions where physical distancing is basically an impossibility. Those that have limited access to digital tools that allow children to study online or employees to work from home. Those without access to basic services such as water, electricity, sewage. However, it's equally important to note that the problem is not cities themselves or density. The agglomeration effects that make cities so successful remain an important part of the solution. The problem lies with the structural inequalities and the quality of cities that were there before COVID-19, as our detailed work looking at mortality rates within cities has shown. Now, the OECD Centre for Entrepreneurship, SMEs, Regions and Cities, is making a major contribution to tackle these problems and to make cities more inclusive, sustainable and resilient. At the very core of our work is a recognition that we need place-based and integrated approaches for policymaking. Policies that stress the importance of all actors and coordinated multi-level governance in tackling local specificities that can break policy silos. And it's important to note that these policies may often pull in different directions. And for cities, those policies can leverage on their specific assets to drive economic efficiency, inclusion, and sustainability. Last year, we consolidated decades of work in this area to develop a set of key principles for urban policy. Principles that are as relevant today, in fact, more relevant than they were when we first developed them. Principles that tell us to design better urban policies, we need to target an effective scale of policy action, be strategic in building smart, sustainable and inclusive cities, a point that was very well made by the Deputy Minister. And crucially, and this is an important part of the way that we operate within the OECD, we need to engage all stakeholders in the policy-making process. Our place-based philosophy has been crucial in delivering on our agenda to drive inclusion, an agenda that has helped deliver change in many countries. For example, since 2010, we've completed urban policy reviews in 7 countries, including Vietnam, and are currently conducting 3 more, including in Myanmar. In Poland, the first country that conducted this exercise, the government implemented a national urban policy framework based on our review. In Mexico, the government changed its approach from focusing only on building houses towards building cities. In Kazakhstan, our work helped the government better understand the need to think beyond administrative boundaries and instead to follow the functional approach that better reflects interdependencies. Now, perhaps I should pause a little bit here and just say a few words about our functional approach, as this is at the core of our efforts to provide sound and internationally comparable data for evidence-based policymaking for cities. Since 2010, together with the European Commission, we've developed a harmonized definition of cities backed by governments called functional urban areas. And today we have a unique database to make meaningful comparisons across more than 50 indicators in all OECD countries that provide trends on demographics, income, air quality, and many, many more. Now, this year we've extended the approach on a global scale, and applying our methodology to Indonesia will allow us to compare Indonesia's urban policy outcomes with cities all over the world. Now, that's all to say that I sincerely hope that Indonesia will be the next country that we'll be able to look back on a successful collaboration with in undertaking such a review. And I took note of the National Urban Policy Review that's planned for the 2045 deliverables. And yet I should also note that we already have many successful examples of strong collaboration with Indonesia. In 2016, for example, just to name just but one, we conducted a policy case study of urban green growth in Bandung. Now, one other initiative that is conducted in CFE, and certainly worth mentioning here at this event, is the Champion Mayors for Inclusive Growth initiative. We launched this in 2016, and today it counts 60 champion mayors committed to working with us and through dialogue and peer learning to tackling inequalities and promoting more inclusive economic growth in cities. Now, during this current crisis, that dialogue has proven crucial to cities. It allows them to effectively respond to the pandemic and in looking ahead, and this is an important part of today's conversation, to rolling out ambitious economic recovery packages. And you'll hear more about our work on this front with my colleague Tadashi Matsumoto takes the floor in the following session. I also took note of the importance of smart cities in Deputy Minister's intervention. Of course, we also have an initiative on smart cities and inclusive growth that's driving forward an awful lot of our work here. So, Vice Minister, distinguished guests, colleagues, ladies and gentlemen, I sincerely hope that today's webinar, through the new ideas it will generate, in addition to the sharing of knowledge and experiences, which is an important part of the way that we feel that these events add huge value, will be another step forward in helping to make our cities more inclusive and sustainable. And I hope it's also another step that further strengthens our collaboration with Indonesia. So many thanks to you all, and I wish you all a very successful webinar.
Baik, terima kasih kepada Mr. Nadiem Ahmad. Baik, Bapak Ibu sekalian, untuk menghemat waktu, langsung saja kita ke acara inti, yaitu kita akan menyaksikan diskusi panel yang akan membahas mengenai respon kebijakan perkotaan terhadap COVID-19, perspektif kebijakan internasional, nasional, dan daerah. Dalam diskusi ini akan mengundang beberapa pembicara dan akan dimoderatori oleh Bapak Mulya Amri. Bapak Mulya Amri ini merupakan Research Director di Kalidata Insight Center dan juga Program Director di Jakarta Property Institute. Beliau adalah spesialis analisis kebijakan, pengembangan ekonomi wilayah, dan juga perencanaan kota. Beliau meraih gelar PhD di bidang kebijakan publik dari The National University of Singapore. Kepada Bapak Mulya Amri, kami persilahkan.
Hello, good afternoon, and good morning for those in Europe and other parts of the world. Welcome to this event. We have a great event coming up for you, and it is part of the OECD Indonesia Joint Work Program, where we will be talking and discussing about the COVID-19 response. And this webinar will specifically talk about cities and COVID-19, and we aim to bring together international, national, as well as subnational policymakers to discuss about how policy can overcome the COVID-19 crisis and build a more inclusive, a greener, and smarter Indonesian cities. We hope that this meeting will provide a platform for Indonesian policymakers and experts, as well as the general public, to exchange views with the international audience on long-term city recovery strategies. For those of you who have just joined us, I would like to tell you that aside from following this webinar on the Zoom platform, you can also follow this webinar on Bappenas RI YouTube account. So that's the YouTube account of the Indonesia National Development Planning Agency, and it is called Bappenas RI or Bappenas RI. Of course, if you join by Zoom, then you can activate the translation feature or the simultaneous interpretation, which you can access from Zoom. Just click the button that says interpretation on the lower part of your screen and choose whether you would like to hear the translation in English or in Indonesian. So for those audience who are following by YouTube, unfortunately, then you cannot follow the simultaneous interpretation. We also accept questions and answers. So for those of you, please use the Q&A function or the button that says Q&A also at the bottom of your screen. And there you can ask questions. Please state your questions briefly and state to whom you are asking the question to. So yeah, so this is a great opportunity for us to learn and discuss more about cities and COVID-19. We have an amazing lineup of speakers representing multiple stakeholders and expertise. First, we have Professor Brian Roberts from Canberra Urban and Regional Futures at the University of Canberra. Hello, Professor Roberts. Our second speaker will be Mr. Dodi Ruswandi who is the Acting Director for Emergency Management from the National Board for Disaster Management of BNPB, Indonesia. Hello, Pak Dodi.
Hello.
Our third speaker will be Ibu Suharti, who is the Deputy Governor for DKI Jakarta for Population and Settlement Management. Good afternoon, Ibu Suharti. Pleasure to have you here. And then our fourth and not last speaker is Mr. Tadashi Matsumoto, the head of unit for the Division of Cities, Urban Policy and Sustainable Development from the OECD. Hello, Mr. Matsumoto.
Hello, good afternoon, good morning.
Thank you very much, everyone, for joining us here. It will be a very exciting speaking and discussion opportunity, as I foresee. I would like to invite our first speaker here to speak first. So each person will have an allocation of about 10 minutes to provide your thoughts on the city's policy response to COVID-19, both from the international, national, and subnational policy perspectives. Let me first introduce our first panelist, who is Professor Brian Roberts. Professor Brian Roberts is currently Emeritus Professor at the University of Canberra in Australia. He is based at the, he's a Professor of Urban Management and Director of Urban Frontiers, also based in Brisbane, Australia. Professor Roberts has been involved in research, education, training policy, and also technical advice to cities, governments, international development banks, agencies, and international development organizations around the world for more than 40 years throughout the world, covering Asia, Africa, Latin America, and the Pacific regions. He has also previously worked with the United Nations Center for Human Settlement, or the UN Habitat. He's worked with the Queensland government. He was a director of the Australian Housing and Urban Research Institute at QUT and the Center for Developing Cities at the University of Canberra. Some of his major publications include Partnerships for the Sustainable Development of Cities in the Asia Pacific region, and wonderful, what a, I'm very much looking forward to Professor Roberts' sharing of COVID-19 crisis in cities. Specifically, Professor Roberts, we would expect you to share about the global perspective on how the health, social, and economic impacts of COVID-19 is folding out in cities. What kind of opportunities and risks are present, and what are some of the future of post-COVID-19 strategies for cities and possible lessons for Indonesia? Okay, without further ado, Professor Roberts, the floor is yours. I think you are still on mute, Professor.
Okay. Terima kasih, Pak Kimia. Okay. Selamat siang. Selamat datang. I will speak in English because my Bahasa is not that good these days. Thank you very much for the OECD and the Government of Indonesia for inviting me to give this presentation at the webinar today. It's a big subject because COVID-19 is in fact something that none of us really anticipated, and the impacts have been very profound. I have 10 minutes to give an overview from a global perspective, and I want to cover my first slide is just on health, social, and economic impacts. I want to look at some opportunities and risks for recovery, because COVID does present us with some real opportunities for change, particularly in the area of climate change, government, and administrative change. I also want to look at the future, because there will be some very, very significant impacts on the way that we design our cities in future. And then, because I'm relatively familiar with Indonesia, I've been there, coming here for 35 years, I'll talk about some short perspective on Indonesian cities. So the next slide, we Basically, COVID began as a health crisis in cities, but it's turned into a major economic, and in fact, we're heading for a very significant social crisis. If we look back at the Spanish flu of 1919, we saw a similar set of impacts, and it was the social shock which prevailed for 3 or 4 years after the pandemic had gone that we need to be fully aware of in the recovery process from this pandemic. What we know is that recovery depends on the industrial composition, the labour markets, and breakdown in trade. Earlier this week, I was launching a book across Latin America on connectivity in cities. And one of the things is that what COVID has done is broken connectedness. And the post-COVID period, once we get the vaccine, will be all about rebuilding connectedness into new sets of urban systems, many of which will operate quite differently from what we experienced 12 months ago. So, as I said, COVID was a disease that started in cities. But what we see most recently in the US, that of the 19 hotspots that popped up last week in the US, 18 were in non-metropolitan counties. So this disease is moving from the big cities, moving particularly in the context of Africa and India into the medium-sized cities, and from there into rural areas. So what we find is that the exposure has caused substantial impact on the way that we're going to look at tourism and future supply chains and environmental systems. The next slide, please. Now, as I said, it's the medium-sized cities that are becoming more vulnerable, and this is something that Indonesia is going to have to keep close attention on. As the minister said, about 50% of the cases are occurring in the broader metropolitan area of Jakarta. However, the real concern is that this will begin to spread. And Indonesia is not particularly well equipped, particularly in Nusa Tenggara, in Maluku, in Papua, to deal with some of these issues as they arise. Now, we've always thought that the density was a very significant factor. As it turns out, that US studies are showing that it's not density, but the size and the level of interaction that are creating the most problems. What they found in a recent study is that a city with double the population density of a smaller one has 4% fewer cases and 7.4% less deaths per capita. So this is an interesting observation. It's actually the level of interaction. And what we're finding, particularly in these medium-sized cities, is that there are increasing levels of interaction, increasing levels of commuting that is actually resulting in a lot of the spread of the disease, particularly in the US. What we do know is that city plans with strict controls over movements of gatherings, basic sanitation, have been handling this crisis much better. And I'm very proud to be in a country that until 2 days ago was COVID-free from community transmission for 4 days. We now have it back. It's just an example of how quickly these things can recur. The social impacts, this is the slide, is really been hit minority people at the bottom end of the socioeconomic spectrum, and especially those with disabilities. What we see, particularly in the case in the US, is that Black and Latino populations are twice as likely to get this disease as whites. We're also seeing that things like access to basic infrastructure, as the Deputy Minister outlined, and precarious living conditions, particularly in slums, make it difficult, if not impossible, to contain the spread of this, particularly in slum communities, or to promote social distancing and quarantine measures. The next slide, please. The impacts economically have been very significant. I'm not going to talk about the impact on the global economy, but really looking at cities. If we look at the slide on the right, what we see here is during the global financial crisis, about 60% of cities were hit by that crisis. But what we see with COVID is that 90% of cities have been hit with this disease, some much more substantial than others. So what we see is that cities that have a much more diverse economic base and structure don't have the same impact on unemployment. They're bouncing back very quickly. But the global domestic travel restrictions have had unprecedented challenges on cities, particularly tourism, and Bali is one part of Indonesia that is being affected. Business tourism has affected Singapore and indeed Jakarta. But in a country like this country, Canada and the UK, it's had a huge impact on international students. And that situation will continue for some time to come. But I think one of the most significant things, and one thing that Indonesia is going to have to focus on very closely, it's led to a decline of the tax base of many cities. And this will have a significant impact on reducing the implementation of plans. And factors such as education, family income, state employment are important factors that affect the vulnerability. Now, I want to go very briefly on what these impacts, the physical impact on cities, because what we're now seeing is just the beginning of what is going to be an emerging part of an ongoing financial crisis. There are big changes occurring in inner city land use, which will mean there'll be less demand for office and retail space, cafes and restaurants in the inner city, less demand for high-rise buildings, which may change the development and indeed the level of investment in activities and in telecommunication. We're seeing the move to working from home, but I doubt that this will exceed more than 20% of employment. We're also seeing that a greater decentralization of employment, reduced commuting and greater demand. But what I want to point out to the audience, particularly for those that are living in larger cities such as Surabaya and Medan in Indonesia, is that we have been building traditionally what we call hierarchical structure cities. We know in Jakarta, which is roughly 10% of the population, more than 20% of the GDP, that the big cities are becoming the orientation point, the focus point. That's left them very vulnerable, extremely vulnerable. But what we're beginning to see in parts of the world is the movement to a more what we call polycentric city. If you look on the right-hand side of the slide, we're going to see a major growth in decentralized developments. For example, outside in Bekasi and south of Depok, those areas will see major growth in the future at the cost to central Jakarta. But we are also looking at new ways of introducing local area networks for sewage, sanitation, energy. This will be part of the smarter infrastructure that will emerge. And these are big physical land use and investment changes that will occur in cities. Next slide, please. Now, it's interesting, risk. The KPMG have analysed what are the most significant, the highest severity and likelihood of risks. On the right-hand side there, you'll see a list of factors. And the very first one is funding availability. Remember, I said earlier that this is going to have a substantial impact on local taxes. So this is going to be one of the most challenging problems for those that are working in Kabupaten Kota, in cities. The other is the whole area in moving into risk management and crisis planning, and in particularly dealing with wider health concerns. Creating healthy communities will be just as important as creating greener communities. In fact, they're all part of one. Now, looking at Indonesia, unfortunately, is the highest infection and death rates in Asia. It's been the big cities that have been hit hard, but this is going to spread to the smaller cities. But importantly, we need to understand that the impact on the economy, about a third of the economy, those that are involved in trade, financial, real estate, hospitality, accommodation services, are the ones that are going to be affected most by this. And a lot of the focus on recovery effort is going to be how to build capacity to rebuild those industry sectors. But I also point out that women and people with disability are also going to need special attention because many of these are insecure employment contracts. Next slide, please.
Professor Roberts, just a quick reminder that you have about 2 minutes going forward.
Okay,
Thanks.
I'm just going to sum up this. Thank you. So what we're seeing in the slide on the future of post-COVID, I think I've got it. The next slide, please, if we could. The next slide, please. Okay. So local business working more collectively in actions for employment. We'll also need to focus on the next slide, please, the 5 key areas: development of competitive import economies, creative smart industries, research and development, and collaborative governance. Now I'm just going to move on to the last slide, which are the possibilities for Indonesia, and I'll sum up with this. Local governments must be better prepared, resourced, educated, and trained. A lot of investment is needed in this. We must ensure that we have more evidence-based, research-based policy. The political economy and political interference is not going to help in this recovery area. We must be beginning to develop local area networks. We can gain an awful lot by collaborating between cities. The work that I'm doing now is on connecting systems of cities and sharing information, reducing costs. We also need to disaggregate more data to local government to enable them to manage these crises during pandemic and also to support economic recovery. I thank you for the opportunity to present this, and there will be opportunities for questions, I'm sure. Thank you very much.
Thank you very much, Professor Roberts. That is very enlightening sharing of your experience and thoughts about how cities deal with the COVID-19 crisis. So some of the points that you mentioned that really interested me was that we may be just at the beginning of the impact. As you mentioned, from previous pandemics, it required 3 to 4 years to fully recover. And those that are minorities, people with disability, people who are living in disadvantaged communities and areas within the city, those require a lot of attention from us. And the preparation, the capacity of the local governments, as well as the national government, is key to enable a more coordinated response to a better COVID-19 crisis in Indonesia City. So thanks very much, Professor Roberts. We will, of course, as you mentioned, have a discussion with all of the speakers afterwards. Let me just now move on to our second speaker, who is Bapak Dodi Ruswandi. Let me introduce him. Pak Dodi Ruswandi is currently the acting deputy for emergency management at the National Board for Disaster Management, or BNPB of Indonesia. So here we have Pak Dodi representing the central government. Pak Dodi has a graduate degree from Civil Engineering from Institute Technology Bandung, and a master's degree also in Civil Engineering from the University of Wisconsin. So his experience has been as a civil servant. He was the main secretary of BNPB up until August 2019, and he also held key roles in BNPB, for example, deputy for emergency response and also the director for logistics. For Pak Dodi, we would like to specifically ask you to share about Indonesia's national support for cities' responses and national recovery strategy. So what are the most affected area of COVID-19 crisis in cities and urban area throughout Indonesia? What kind of support from the national government? And what are the short, medium, and long-term national recovery strategies? Dodi, you have about 12 minutes to share your thoughts on the matter. Please go ahead. Thank you. I think you may still be on mute, Pak Dodi.
Oke, terima kasih Pak Moderator. Pada kesempatan ini saya akan coba menyampaikan, saya dalam bahasa saja ya, akan coba menyampaikan apa yang sudah dilakukan oleh pemerintah pusat dalam mensupport COVID-19 di daerah. Dan sesuai dengan temanya adalah how national support the city recovery, city response. Baik, saya mohon izin share dulu screen-nya ya, udah bisa ya Mas. Oke. Mungkin kita lihat dulu, pertama mungkin karena ini topiknya adalah tentang kota ya, jadi saya mungkin juga akan coba ngambil contohnya misalnya kota Jakarta saja, memang lebih lengkap datanya dan juga infrastruktur yang sudah kita bangun 9 bulan terakhir ini. Kalau kita lihat di kota Jakarta, bahwa setiap bulan antara yang konfirmasi positif COVID dibanding dengan yang sembuh dan juga yang case fatality rate-nya itu bisa terlihat setiap bulan di sini bahwa pada bulan Desember ini cenderung agak sedikit menurun. Sebenarnya nanti akan saya jelaskan. Dan kalau kita lihat di sini juga recovery-nya itu 90% lah ya, dan juga affected people who lose their life sekitar 1,92%. Nah, ini dibanding sama tempat-tempat kota besar lain kayak Surabaya, juga sepertinya Jakarta angkanya lebih rendah dan recover, dan juga yang meninggal juga lebih sedikit. Nanti kita lihat kenapa, karena ini bagaimana peran kota itu bisa juga mengendalikan COVID ini. Baik, karena waktu saya sedikit sekali, jadi mungkin sebelum kita lihat apa yang sudah kita lakukan dari National Support, kita mengingatkan kembali bahwa tahun 2015 itu ada Sendai Framework for Disaster Risk Reduction. Jadi saya pengen melihatkan bagaimana dari perspektif kebencanaan, bahwa kita dulu pernah semua negara itu sudah komit dulu di Sendai bahwa kita mau fokus untuk pada underlying disaster risk reduction termasuk pandemik. Itu sudah kita cetuskan dulu pada saat di Sendai. Tetapi pada saat itu sepertinya tidak ada negara yang aware terhadap itulah ya. Jadi dianggap itu hanya semacam komitmen saja. Nah sekarang it's happening now gitu ya. Jadi sekarang terjadi pandemik itu, dan sekarang akhirnya kita semua tidak siap. Ya. Oke, dalam situasi seperti itu, khusus untuk kota Jakarta, kota ini sebenarnya juga waktu kita mulai dulu bulan Maret itu juga, waduh setengah mati, semua orang rumah sakit penuh, semua penuh, malah media isinya bagaimana orang dari rumah sakit satu ke rumah sakit lainnya tidak dapat tempat dan mereka sudah meninggal di tengah perjalanan. Dan ini true story, ini terjadi. Jadi bagaimana kota kita ini memang tidak siap diserang secara masif oleh satu hazard yang namanya pandemik ini. Ya, dan itu kami ingat waktu itu saat gugus tugas dibentuk ataupun National Task Force dibentuk bulan Maret, itu semuanya serba minim. Dan disitulah kita sadari bahwa memang infrastruktur pelayanan kesehatan kita ini memang tidak siap untuk diserang secara masif, secara mendadak. Nah, apa yang sudah dilakukan oleh pemerintah pusat kepada daerah? Karena sebenarnya lokus terjadinya semua ini kan di daerah. Jadi di tingkat pusat kita punya gugus tugas nasional, dan di tingkat daerah juga punya gugus tugas ataupun task force ya. Di provincial level juga ada task force di district level, local level. Tapi bagaimana task force di national level bekerjasama mensupport di local level, atau dalam konteks ini adalah di city level. Jadi bagaimana city ini bisa respon. Nah, ada beberapa hal selama 9 bulan ini yang sudah kami lakukan. Ya, artinya yang sudah dilakukan oleh pemerintah, baik itu BNPB maupun Kemenkes bersama-sama. Dari pusat kita mensupport pemerintah di daerah. Jadi pertama adalah bagaimana kita meningkatkan hospital bed ya. Juga ada 98 lah itu rumah sakit rujukan di Jakarta yang kapasitasnya sudah ditingkatkan bersama-sama. Disupport oleh pemerintah pusat. Dan juga ada yang spesifik di sini, ini juga akan menjadi suatu contoh bagus bahwa sebenarnya ini hanya accidentally ya. Kita punya 10 tower bekas Asian Games, dan ini 10 tower ini kalau kita isi bednya semua dengan pasien itu ada sekitar 12.000 bed lebih ya. Dan ini adalah tempat isolasi rumah sakit darurat paling terbesar di Asia Tenggara. Tidak ada rumah sakit yang bednya 12.000. Tapi by chance saja ini kebetulan ada di Jakarta, dan ini mendadak bulan Maret itu 2 minggu langsung kita transform menjadi suatu rumah sakit untuk menghadapi pasien-pasien COVID. Dan ini lesson learned yang sangat nyata dan bagus, sehingga sekarang itu memang kapasitas penampungan pasien di DKI ini sudah tinggi sekali. Ya, itu baru Wisma Atlet, belum lagi 98 rumah sakit yang sudah kita tingkatkan kapasitasnya bersama-sama dengan Pemda DKI. Belum lagi sekarang kita punya beberapa hotel-hotel yang sudah kita siapkan untuk isolasi yang memang tidak ada gejalanya. Dan sistem berlapis ini sepertinya memang diperlukan. Dan ini merhati bahwa walaupun sebenarnya sekarang case itu naik, tetapi karena kapasitas setelah 9 bulan ini kita tingkatkan dengan besar sekali, sehingga risikonya memang mulai menurun. Jadi kalau nanti tadi dilihat bahwa recovery rate-nya 90%, ya itu memang karena kapasitas daripada fasilitas kesehatan itu memang sudah ditingkatkan di DKI. Kalau kita lihat lagi tadinya kapasitas testing dulu sebelum ada COVID itu hanya 7 laboratorium COVID di Indonesia ini. Tetapi setelah ada Satgas, kita bekerja keras bersama-sama dengan Kemenkes dan teman-teman di daerah. Sekarang jumlahnya sudah 378 laboratorium. Jadi jangan kaget kalau di DKI itu yang dites itu banyak sekali per hari itu. Sehingga juga akhirnya yang positif rate-nya juga pasti juga akan muncul. Dan kalau melihat angka pasti besar, tetapi setelah 9 bulan sepertinya kami merasa DKI sudah cukup kuat sekali. Dan justru sekarang Surabaya yang harus kita tingkatkan. Kapasitas mereka tidak punya Wisma Atlet seperti di DKI. Nah, selanjutnya juga upaya yang sudah dilakukan oleh pusat ya adalah mensupport daerah dengan emergency response fund lah ya. Jadi kita punya anggaran yang bisa kita gesek, kita support terus seluruh daerah, seluruh provinsi. Jadi seperti laboratorium mereka perlu regen terus setiap saat, tidak boleh putus. Nah, itu disupport terus oleh pemerintah pusat melalui BNPB maupun Kemenkes, APD dan lain sebagainya. Itu tidak henti-hentinya sampai hari ini. Dan memang beberapa waktu yang lalu kami rapat bahwa di Jawa Barat, Jawa Tengah, Jawa Timur, mereka sekarang sedang khawatir akan adanya libur panjang di akhir tahun. Tapi untuk hal tersebut mereka sudah melapor ke kita dan kita akan support itu. Mereka sekarang sedang menyiapkan semua bed tambahan di Bandung Raya, di Malang maupun di Semarang, Boyolali, dan juga di samping itu juga kita juga pemerintah pusat juga membangun beberapa rumah sakit darurat, Surabaya, Lamongan, Biak, Pulau Galang, Banda Aceh, Bangka Belitung, Manado. Ini sudah selesai semua ini. Dan juga Malang baru selesai, sehingga daya tampungnya juga 500 bed. Juga Bandung Raya sekarang disiapkan sekarang, Boyolali. Dan juga nanti di bulan Januari juga ada tahap berikutnya, kita juga akan membangun lagi rumah sakit lapangan. Dalam rangka apa? Untuk menampung kalau terjadi second atau third wave lah gitu ya. Jadi kita tetap working on it dan jangan pernah percaya bahwa COVID ini akan berakhir, tapi kita yang penting adalah bekerja meningkatkan kapasitas terus. Dan ini kita lakukan terus. Dan yang
Pak
kedua
Dodi, mungkin sekedar mengingatkan cepat aja, waktunya sekitar 2 menit lagi, Pak. Makasih.
Kita juga meningkatkan mendeploy juga tentara di sini, sehingga itu juga bisa mempercepat proses kita. Baik Bapak, langsung saja saya mungkin terakhir bahwa National Recovery Strategi kita adalah bagaimana dengan adanya pengalaman tersebut, lesson tersebut, bagaimana kota itu bisa mendevelop policy ya dan regulasi sehingga kota itu juga memang punya persiapan apabila terjadi serangan masif bisa ditransform langsung menjadi suatu rumah sakit darurat. Nah, ini pengalaman yang sangat berharga dan juga mulai kota juga mengidentifikasi tempat-tempat bangunan publik mana yang bisa juga kita transform apabila kita nanti terjadi serangan-serangan virus yang akan datang. Dan ini perlu dilakukan dan juga sekaligus juga memperkuat institusi dan sumber daya yang ada di kota tersebut sehingga siap menghadapi apabila terjadi massive impact critical ataupun disaster situation. Terakhir adalah continuous effort in educating people to understand and adaptive to any incoming infectious disease. Saya rasa ini mungkin yang dapat kami sampaikan strategi ke depan berdasarkan lesson learned yang sudah kita lakukan di National Task Force di tingkat pusat. Gimana saya itu Pak Moderator, sharing apa yang sudah kita lakukan, lesson learned kita di negeri ini. Demikian Pak, terima kasih.
Baik, terima kasih banyak. Thank you very much Pak Dodi from BNPB, the National Disaster Management Agency. I think Pak Dodi has explained to us some of the very promising responses that the Indonesian government has taken, including the expansion of hospitals and also labs, field hospitals and emergency response funds. And so it was very impressive to see this largest emergency hospital in Southeast Asia with 12,000 beds. So we hope that further on it will help Indonesia and also Jakarta as part of Indonesia to recover faster and much better from COVID-19. We will move on now to our third speaker. Our third speaker is Ibu Insinyur Suharti, MA PhD. Ibu Suharti is the Deputy Governor of DKI Jakarta Province for Population and Settlement Management. Dr. Suharti obtained her bachelor's degree from Bogor Agriculture University, and she also went on to study for her master's degree in applied economics at the University of Michigan, Ann Arbor, and she received her PhD degree from the Australian Demographic and Social Research Institute at the Australian National University, or ANU, Australia. She has made a career as a civil servant, first with the National Development Planning Agency at Bappenas. She was a long time working at Bappenas, and then she took part in a national bidding to become the Deputy Governor for Population and Settlement Control at the Jakarta Capital City Government, in which she obtained that position successfully. So, Ibu Suharti, we would like for you to share a little bit about the challenges and experiences in managing COVID-19 crisis in Jakarta as a mega city. Of course, we know that Jakarta DKI Jakarta as a core, but it is in the core of a huge metropolitan city of Jabodetabek. And what is Jakarta's experience in managing the COVID-19 crisis, especially with the densely populated places within Jakarta, and also the connections with the suburbs of Jakarta, including urban mobility and such. We would like to give the time for also about 12 minutes to Ibu Suharti. Please, Dr. Suharti, the floor is yours.
Terima kasih, saya akan share screen. Oke. Sudah dilihat ya? Terima kasih moderator yang sudah memperkenalkan saya, dan juga terima kasih kepada Bappenas yang sudah mengundang saya untuk berbagi informasi di Jakarta terkait dengan tantangan dan pengalaman Jakarta dalam mengelola COVID-19. Saya akan berbicara dengan bahasa Indonesia, tapi paparan saya sudah ada dalam bahasa Inggris. Saya akan sedikit mengupdate situasi terkini di Jakarta, kemudian menjelaskan tentang tantangan yang ada, dan sedikit pengalaman terkait dengan pengelolaan COVID, apa yang kemudian kita peroleh dari pengalaman tersebut, dan rencana ke depan seperti apa. Ini kasus terkini kemarin sore, bahwa in total sudah ada 156 ribuan orang yang terkonfirmasi COVID di Jakarta, tetapi yang aktif sekarang tidak sampai 12.000, alhamdulillah. Kemudian case fatality rate juga sudah kita tekan sedemikian rendah 1,9%, dengan angka kematiannya jumlah yang meninggal 3 ribuan orang. Recovery rate juga sangat tinggi, ini 90,4%, jauh lebih tinggi dari angka nasional yang sekitar 82%. Ini situasi kemarin. Nah, tantangannya apa? Jakarta itu densitasnya tinggi, 10,5 juta orang ada di Jakarta, seperempatnya orang miskin dan rawan rentan miskin, dan inequality cukup tinggi, Gini rasionya hampir 0,4. Artinya apa? Bahwa banyak warga Jakarta yang membutuhkan bantuan, tidak hanya terkait dengan layanan kesehatan, tetapi juga layanan lain, termasuk bantuan ekonomi. Banyak dari mereka yang terputus pekerjaannya, menjadi pengangguran, bahkan data terakhir dari BPS, angka pengangguran di DKI Jakarta mencapai angka tertinggi 10,9%. Ini tentunya menjadi tantangan yang luar biasa untuk DKI, bagaimana kita bisa mengelola COVID ini dari semua sektor. Kemudian terkait dengan ekonomi juga, bahwa Jakarta adalah pusat bisnis, pusat ekonominya Indonesia. Kita kontribusi pada nasional GDP sekitar 17%. Kemarin data terakhir juga masih menunjukkan 17,5% meskipun di dalam pandemi. Artinya kita tetap perlu mengelola itu dengan baik. Ditambah lagi di Jakarta siang hari itu bisa sampai 14 juta orang. Lebih dari 1,5 juta orang bergerak di sekitaran Jakarta sebagai commuters. Ini tentunya tantangan yang tidak sedikit seperti yang tadi disampaikan Pak Amri. Mengelolanya tentu sangat perlu kehati-hatian, karena bagaimanapun juga Jabodetabek ini sudah menjadi satu epicenter sendiri, satu kesatuan dalam seluruh semua sektor. Bagaimana dengan pengalaman Jakarta? Ada beberapa prinsip yang memang kita pegang betul di dalam pengelolaan COVID-19 ini. Factuality, urgency, and collaboration. Ini 3 hal yang tidak pernah kita tinggalkan dalam pengelolaan COVID. Kemudian di bidang kesehatan tetap mengacu kepada saran WHO, perbaiki testing, tracing, dan treatment, dan untuk masyarakat umum tetap 3M, memakai masker, menjaga jarak, dan mencuci tangan. Ini yang tetap harus dikerjakan setiap saat. Nah, urgency. Awal Januari DKI sudah bergerak. Jadi sebelum Presiden mengumumkan kasus pertama awal Maret, di bulan Januari 2 bulan sebelumnya, Jakarta sudah melakukan sosialisasi terkait dengan virus Wuhan, waktu itu belum disebut COVID-19. Lebih lanjut, kita juga langsung menyiapkan call center 12 jam untuk tujuannya sebagai edukasi. Karena waktu itu banyak sekali warga yang ingin tahu apa sih virus corona itu, apa sih Wuhan pneumonia itu, dan apa simptom yang dirasakan. Jadi ribuan orang setiap hari menanyakan hal itu, sehingga kami menyediakan call center 12 jam khusus untuk COVID ini. Setelah pengumuman ada kasus, kita langsung membuat tim respon dari berbagai macam unsur, dari Pemda sendiri, dari TNI, Polri, kemudian juga para ahli, expert, termasuk organisasi-organisasi kesehatan masuk di dalam tim tersebut. Sehingga dengan demikian kita inginnya Jakarta mengelola COVID ini dengan lebih baik lagi. Nah, berdansa dengan grafik, dancing with the curve, itu kita lakukan karena itulah pengalaman dunia ketika menghadapi pandemi, termasuk Spanish flu di tahun awal 1900-an. Jadi ketika ada tambahan kasus, maka ada restriksi yang lebih yang kita lakukan. Tetapi ketika kemudian ada flattening, kasus menurun, maka langsung kita rilekskan. Bagaimanapun juga antara kesehatan dan ekonomi harus dilakukan secara baik, seimbang, sehingga nyawa terselamatkan, tetapi ekonomi juga tidak sangat terpuruk. Nah, ini kami mungkin teman-teman juga sudah paham betul ke waktu pertengahan September kita menarik rem emergency karena peningkatan kasus yang luar biasa dalam waktu setengah bulan karena dampak dari long weekend di pertengahan bulan Agustus. Dan kemarin sempat turun, tetapi terus kemudian ada long weekend lagi, angkanya meningkat lagi. Tapi dengan demikian kita bergerak terus ketika membaik situasinya, kita rilekskan sedikit, ketika naik lagi kita perketat lagi, kita PSBB-nya demikian. Di kesehatan kita testing, tracing, dan treatment, tadi Pak Deputi sudah menyampaikan, Jakarta baik, labs-nya kita sudah punya 76 labs yang jejaring labs, dengan kapasitas kalau semuanya dipakai itu 22.000 lebih. Dan jumlah testing yang kita lakukan sudah 8 kali dari rekomendasi WHO. Rasio tracing 6:1, tetapi kami juga melakukan active case findings untuk daerah-daerah yang rawan risiko penularan seperti di perkampungan kumuh dan juga pasar-pasar tradisional. Dan untuk treatment ini kita terus tingkatkan dari yang waktu itu hanya beberapa rumah sakit saja, sekarang sudah ada 98 rumah sakit negeri dan swasta yang digunakan untuk menangani COVID. Ini contohnya trends untuk tes harian. Jadi kita terus meningkat, kalau misalnya ada penurunan itu memang karena kasusnya yang sudah mulai menurun sehingga tracing tentunya menjadi lebih sedikit. Ini gambaran rumah sakitnya. Bayangkan waktu itu ketika rumah sakit antara jumlah tempat tidur dan ICU sudah sangat berdekatan dengan jumlah pasien, sehingga emergency break memang harus dilakukan supaya rumah sakit juga tidak kolaps dan angka kematian juga bisa ditahan untuk tidak meningkat. Safeguarding the vulnerable groups, orang miskin, orang-orang rawan miskin, tenaga kesehatan kita lindungi betul. Bantuan sosial kita sediakan banyak dan alhamdulillah juga dari pemerintah pusat mengalokasikan yang lebih banyak lagi untuk Jakarta. Waktu sekarang dari 2,4 juta kakak yang diberi bantuan sosial, 1,3 juta diberikan oleh pemerintah pusat. Dan untuk Jakarta sendiri karena APBD juga turun jauh untuk menutup sebagian bansos digunakan dana potongan TKD, tunjangan pegawai 50% dialokasikan untuk menambah bantuan sosial untuk masyarakat miskin. Dan untuk tenaga medis dan tenaga kesehatan tidak hanya medis ya, kita proteksi betul, kita sediakan akomodasinya, transportasinya, dan juga insentifnya. Dengan demikian kita harapkan kesejahteraan mereka tetap terjaga dan perlindungan pada mereka lebih terjamin, termasuk tidak adanya penularan pada keluarga. Kita bangun digital system juga. Jaki, teman-teman kalau belum install, mungkin bisa install. Jakarta ini di dalamnya ada CLM, itu Corona Likelihood Meters, untuk mencek risiko kita terhadap COVID. Nah, kalau ternyata berisiko tinggi, maka bisa dihubungkan dengan puskesmas terdekat untuk bisa dilakukan tracing, baik itu menggunakan rapid test maupun PCR. Kemudian di situ juga ada kontak tracing. Jadi siapa yang ditemui selama beberapa hari terakhir sebelum terkonfirmasi COVID. Dan juga yang sangat penting di sini adalah fitur untuk checkpoint monitoring. Jadi tempat-tempat usaha, restoran, dan sebagainya juga menggunakan fitur ini. Nah, yang tidak kalah penting adalah pengembangan yang CRM. Jadi warga sudah bisa juga melaporkan kalau ada orang-orang yang tidak taat pada protokol COVID. Kolaborasi dilakukan oleh Jakarta. Tidak mungkin penanganan COVID dilakukan oleh pemerintah saja. Jadi salah satu yang kami lakukan adalah melakukan kolaborasi sosial berskala besar. Di satu sisi ada PSBB, pengetatan, di satu sisi lain kita punya kolaborasi. Dan ini kita mulai awal bulan April ketika menjelang bulan puasa, dan ini sampai 650.000 paket sembako yang sudah kita bisa berikan kepada masyarakat, oleh masyarakat juga. Kami hanya menyediakan platformnya. Nanti teman-teman juga bisa lihat di corona.jakarta.go.id, di situ ada KSBB. Bagaimana kita bangun platform tersebut. Kemudian juga ketika warga sudah mulai kesulitan, SMI, UMKM mulai kesulitan, kita bantu juga. Kita siapkan juga KSBB-nya. Sekarang sudah ada 85 kolaborator, sudah banyak bantuan yang diberikan, termasuk training, ada 170 training, ada juga bantuan modal, dan banyak sudah SMIs yang akhirnya terlibat di dalam program ini. Dan yang tidak kalah penting juga untuk pendidikan, karena kita tahu ada warga-warga miskin yang sekolah yang tidak punya gawai. Kita juga buatkan kolaborasinya, sudah sangat banyak, ini SIM card Pradana itu sampai 61.000 sudah terkumpul, ada HP, ada tablet, ada laptop yang kita berikan baik pada siswa miskin maupun guru yang memang tidak punya peralatan. Di luar itu banyak sekali, dari kesehatan apalagi luar biasa banyak bantuan-bantuan yang kita peroleh karena kolaborasi itu. Bahkan dalam penyiapan sistemnya juga dibangun oleh kolaborator. Jadi kami dibantu oleh McKinsey, kami dibantu oleh Konferi untuk membangun sistem komunikasi dan informasi terkait dengan kesehatan. Dan ini hal-hal yang lain lagi, termasuk membantu seniman, termasuk membantu untuk kegiatan transportasi, ini juga kita lakukan di dalam kolaborasi di Jakarta ini. Pembelajaran, transparansi ini sangat penting untuk kita perkuat, karena dengan transparansi orang akan tahu betapa risiko COVID ini cukup tinggi. Bagaimana masyarakat akhirnya bisa sadar bahwa mereka harus memproteksi diri menjadi lebih baik lagi. Kami berkolaborasi juga misalnya dengan Lapor COVID ya, untuk melakukan survei ke masyarakat bagaimana tanggapan mereka terhadap penularan. Kemudian juga kami membuat survei juga bagaimana tanggapan masyarakat terhadap pelaksanaan PSBB. Jadi dengan adanya informasi-informasi seperti itu, transparansi, warga menjadi lebih terbuka pemahamannya terkait dengan semua dampak-dampak yang mungkin terjadi ketika mereka berhadapan dengan COVID. Data sangat penting. Kami membuat data yang akhirnya sampai detail dan sebagian juga real time, sampai bahkan level RT RW. Jadi seperti polisi, kepolisian, kemudian TNI juga kami berikan akses untuk mereka membantu di dalam penanganan COVID di level bawah. Jadi PSBB tingkat RW waktu itu dibantu oleh TNI dan Polri, dan juga memungkinkan dasawisma, kader dasawisma yang sekarang ada sekitar 75.000 untuk memantau warganya yang terdampak COVID, yang terkena COVID. Jadi mereka diisolasi di mana, apakah punya anak yang perlu dibantu oleh warga sekitar, itu semua ada di dalam informasi itu. Dan sekarang Dasawisma juga sudah membuat platform yang platform mereka sudah ditambah dengan penanganan COVID. Information and technology sangat penting menjadi semuanya lebih memudahkan dan pekerjaan menjadi lebih efisien. Kolaborasi dan komunikasi seperti saya sampaikan tadi, semuanya sangat besar manfaatnya di dalam membantu kami di Jakarta dalam mengelola krisis COVID-19 ini. Apa kemudian yang akan dilakukan? Tidak berhenti di situ tentunya, karena kita sadar bahwa COVID-19 ini tidak akan hilang dalam waktu singkat ke depan, maka yang jelas vaksinasi massal perlu dilakukan, kapanpun itu tetap sesegera mungkin perlu dilakukan supaya kondisi menjadi normal. Kemudian edukasi terhadap pemakaian masker, cuci tangan, jaga jarak ini sudah tidak mungkin untuk dihentikan. Ini harus menjadi bagian dari kehidupan ke depan. Dan yang lebih penting lagi, kita set bar baru, target baru untuk melakukan mainstreaming dan kolaborasi public health, urban public health, kesehatan masyarakat kota. Apa yang kita lakukan? Satu, memastikan jelas kesehatan kuratifnya tetap harus diperkuat, rumah sakit, puskesmas kualitasnya harus lebih baik dan merata tentunya. Kemudian sektor lain seperti apa? Harus diperkuat, dan ini pembangunan yang dilakukan harus dihubungkan dengan faktor-faktor yang mendukung kesehatan masyarakat. Misalnya transportasi, untuk mendukung bagaimana masyarakat bisa bepergian dengan mudah, dengan berjalan kaki, dengan bersepeda misalnya. Kemudian perumahan, transit oriented development menjadi bagian yang tidak kalah penting di dalam pengembangan kota. Apalagi menyediakan tempat ruang terbuka untuk warga, ruang hijau, yang mereka juga bisa menggunakannya untuk aktivitas olahraga misalnya. Kegiatan-kegiatan di masyarakat diperkuat untuk mendukung gaya hidup sehat. Jadi seluruh komponen, seluruh pembangunan yang akan dilakukan di Jakarta akan mengarah ke situ. Sekarang PTSP, bagian yang mengelola izin di Jakarta, sedang kita minta siapkan untuk membuat seperti checklist apa saja variabel-variabel atau indikator-indikator yang akan digunakan ketika mereka akan menyetujui atau tidak usulan-usulan pembangunan di Jakarta. Bapeda juga demikian, membuat perencanaannya itu sudah mainstreaming terhadap urban public health. Jadi itu yang kami akan kerjakan. Nah, ini kami mengundang teman-teman hari ini dan besok ada JDCN Forum 2020, banyak sekali topik-topik yang kita bahas, termasuk urban health besok akan dibahas juga. Jadi kami mengundang semuanya untuk bisa berpartisipasi. Mari kita jadikan Jakarta menjadi kota yang lebih baik. Terima kasih.
Thank you very much, Dr. Suharti. It's a very interesting presentation, and I deliberately gave a little bit more time for you because of our topic here. We're talking about cities and coronavirus. So here, DKI Jakarta as the city, as the local government is, of course, at the forefront of the response to COVID-19. So we will now go on to our fourth speaker. The fourth speaker is Dr. Tadashi Matsumoto, who leads the OECD's work on sustainable urban development and partnership. So he provides strategic leadership and oversees the research and analysis on various topics related to cities and urban development, including zero carbon transition and a territorial approach to the SDGs. So Tadashi is the lead author of Compact City Policies, as well as Urban Green Growth in Dynamic Asia. And before joining the OECD, Dr. Matsumoto worked for the Japanese Ministry of Land, Infrastructure, Transport, and Tourism for more than 10 years. He has a Master in Urban Planning from New York University and a PhD from Tokyo University in Engineering. So we would like to invite Dr. Matsumoto to share with us a little bit more about the OECD's studies, especially the policy note. What kind of policy responses have cities been mobilizing in terms of responding to COVID-19? So if you can please share a little bit about the lessons from the global experience and what can Indonesia learn from there. So you have also 12 minutes as the others. Thanks very much. Please, Dr. Matsumoto.
Thank you very much, moderator. This is my real pleasure to present our work on the city's policy response from the OECD work. I am already sharing my screen. I think, can you see my screen?
Yes, we can see it. Yeah.
Okay, let me make it. Okay. Can you see the full screen now?
Yes, it's in full screen.
Yes. Thank you very much. Okay, so today's presentation is really focusing on this policy note, which OECD has produced to understand how cities in the world is responding to the COVID-19 crisis. And then we try to extract some lessons learned from this experience. Just 2 slides I have is about how OECD works and support countries and cities, and which already my Deputy Director Nadim explained a bit. Just 3 points, the methodology, how we work. So we are very much serious on urban data, in particular methodologies of data which allows us internationally compare different cities, because country has different definitions of cities or different circumstances. So it's very important to compare different countries and cities. So we are really serious on urban data. As Nadim referred to, functional urban area approach, and also we are very much working with different countries to define cities and then metropolitan areas. Second area is cross-cutting policy guidance. Strong evidence base is, of course, the foundation of policy guidance. So we have been working directly with different countries to provide assessment and a sound policy advice to the government. And then also we provide a policy forum where policymakers and then also policy practitioners can freely exchange professional policy matters, and then exchange and learn from each other. In Southeast Asia, in particular in Indonesia, we have been recently working on different issues on urban policies. Building Resilient City Report, which was published in 2018, is one of the important one. We picked Bandung, as Nadim also mentioned, to assess the disaster risk management policies. And also we studied on green growth, and we are working on a national level comprehensive urban policy reviews in Vietnam, finished in 2018, and then we are working on Myanmar, as Nadim also mentioned. The policy response note is a result of our work since March 2020, looking at more than 100 cities of the world, focusing on basically 2 areas. One, looking at short-term responses during lockdowns or easing of lockdowns, and looking at different policy responses. And then second, we look at long-term actions of cities. We have this note at the OECD, available at the OECD website. And the language is now English, French, Spanish, Portuguese. In fact, we also have a Japanese version just launched 2 weeks ago. Cities are really an epicenter of the COVID-19 crisis. So in this policy note, the the short-term responses are analyzed in these 6 categories that you see in a graphic. And we try to understand how what are the best lessons and what are the experience that can be shared with other countries. What we have found, the first key message is that cities are both the most vulnerable areas, but at the same time, it's a critical place, a critical actor for responses. So for example, cities are key players in implementing nationwide measures, but also devising innovative recovery strategies within their jurisdiction. Excuse me. Based on these key findings, we have been developing 10 key lessons that emerged from the notes to rethink citizen urban policies in the COVID-19 era. We grouped into 3 categories. The first one is about the impact of the crisis. Second one is a paradigm shift illustrated by city responses. And then the third one group is a need for an integrated approach. So I try to go walk you through quickly the 10 key lessons from now. The key lessons, lesson number 1, COVID-19 affected territories differently, which highlights the need for a place-based and people-centered approach. So the graph is showing that the regional variation, so within one country, you see such a big difference in terms of the impact. In this case, actually, we are showing the fatalities. Just pick one example from the United States. The deaths per 100,000 inhabitants is lowest in the Vermont states, which is 9 deaths per 100,000, versus the largest one is 184 in New Jersey. So it's more than 10 times, no, 20 times of difference just between states. Lesson 2 is also important that the health crisis is really turned into a major economic and social shocks. And that's why the city's exposures and recovery really depends on the socioeconomic structure of regions, which has also varied across different places of the country. Lesson 3 is about urban density. So what we have found from different evidence is that health problem is not directly related to urban density per se, but rather structural inequalities or the quality of urbanization. This is illustrated by the case of the United Kingdom and the city of New York, where you see the highest higher contagion rates are correlated to socio-economic vulnerabilities, not density itself. This is an important factor for findings for urban policies. And lesson 4 related is that this crisis most hit and also exacerbated the inequality across people and places, especially for vulnerable people groups.
Dr. Matsumoto, just a quick reminder, you have 3 minutes.
Okay, thank you very much. Try to go quickly. Lesson 5 about digitalization. So the digitalization is a major game changer during the crisis and will remain a key component of the new normal. The important point is that, again, the regional disparities. So teleworkability, this graph is showing, has also a large disparity across regions, which is important to take into account. Lesson 6 is talking about mobility and accessibility. So because of the COVID-19 crisis, we have rediscovered the importance of proximity. And this proximity is creating a new move of policies as illustrated as a 15-minute city concept proposed and applied, trying to be applied in the city of Paris. Lesson 7, talking about Zooms or greater effect because of this confinement and the travel restrictions, have accelerated people's environmental awareness and also a better understanding of low carbon transition, and also from linear to circular economy. These concepts for environmental policies are now more politically and socially acceptable. Lesson 8, again, this is an important point, trust in government. Some countries like US, France, Japan has increased the trust, some countries decreased, and the key is how to engage citizens and then wider range of stakeholders for policy making decisions. Lesson 9, yes, this is talking about importance of integrated approach. So the COVID-19 shocks pose for a stronger focus on resilience. Resilience has, of course, a broader concept and it needs an integrated approach. Lesson 10 is the global agendas like SDGs, New Urban Agenda, Paris Climate Agreement, Sendai Framework for Disaster Risk Reduction. These are both timely and relevant to reshape planning policies, strategies for urban areas. So this is the last slide. So this is the 10 lessons that we have been identifying. And we are very happy to use these lessons and also the analytical methods we used to apply to Indonesian cities, and then providing an assessment and recommendation to the urban and the national policymakers. Just the 3 tools. One is an OECD community. We have a working party on urban policy where member states and non-member states can gather and exchange ideas. We are very welcome Indonesian government to come regularly to this meeting. You're already invited, and we are very happy to welcome you. And then also we have a national urban policy program, which is a global knowledge exchange places, which is also very much welcome. And then also, as Nadim also mentioned, we are interested in working together on National Urban Policy Review of Indonesia to build back better and greener cities. So thank you very much for your attention, and I'm very happy to have a further exchange. If you have more questions, please feel free to contact me. Thank you very much.
Thank you very much, Dr. Matsumoto. That is a very good way to put the lessons. I really like how you put in the 3 lessons, oh no, the 10 lessons, but combined into 3 frameworks. One is that the impact is asymmetric and that we need an integrated approach and that we also need a paradigm shift. Okay, so audience, thank you very much for your questions. We have received many questions now, and each of our speakers are already earmarked to receive your questions. So I will pose the questions one by one to the speakers according to the sequence in which they spoke first. So the first question will be for Professor Brian Roberts. We don't have that much time, so I will give each speaker to provide your answer maybe just for 2 minutes to 2.5 minutes. So Professor Roberts, here is a question from you from Brian Christian Chandra Putra. So the question is, what is your perspective on the recently signed RCEP, or the Regional Comprehensive Economic Partnership, which directly involve 15 Asia-Pacific nations to the socio-economic future of related cities and their connectivity? So especially during this pandemic, how do you see the digital economy and urban technology would affect the role of future cities in this issue? Go ahead, Professor Roberts. Please unmute yourself first. Okay, we can hear you.
Yes, there is a tendency for many nations to think that we will decouple. In other words, our economies will separate. But trade will continue to be an important part of the recovery effort. So the new Regional Comprehensive Economic Partnership, I think, helps to cement together a number of different bilateral arrangements. So for the good of the region, I think it's a very positive outcome. As for the digital economy, we are in the digital economy. Information is the infrastructure of the 21st century. It's basically going to be driven more and more of our jobs will be driven by technology. So I see this as just part of the new economy that will emerge. The challenge is for developing nations, and particularly for poorer regions and economies, to be able to have access to that technology information and to be able to use it for the benefit of development of their local communities and their regions. Thank you.
Thank you very much, Professor Roberts. So the next question, I will pose this to Pak Dodi Ruswandi. Hello, Pak Dodi. So here is a question. It's posed from Hardianti Ika, and you're free to answer in Indonesian. The question is also posed in Indonesian, so maybe the translator can also recite what the question is in English. So there's two questions here. Kebijakan apa yang akan diambil oleh pemerintah untuk mengantisipasi kondisi yang akan terjadi seiring dengan diberlakukannya masuknya aktivitas anak sekolah mulai bulan Januari 2021. Lalu yang kedua, bagaimana cara pemulihan krisis kesehatan di wilayah perkotaan agar segera berakhir dan masyarakat bisa percaya dengan kebijakan pemerintah. Pak Dodi, silakan mungkin bisa dijelaskan.
Baik, terima kasih Pak Moderator. Jadi sekarang memang ada rencana bulan depan mau dicoba anak-anak mau masuk sekolah. Tetapi sebenarnya kami ini di sini di Satgas ini sudah ada analisis dari BLC dari mana daerah-daerah yang memang merah, kuning, kategorinya sudah ada dan juga hijau, dan itu harusnya menjadi dasar bagi pemerintah daerah untuk melaksanakan itu. Jadi saya rasa tentunya nanti juga kebijakannya akan bertahap dulu, dan di mana daerah-daerah yang memang bisa kita kawal yaitu mungkin daerah hijau ataupun orange ya kategorinya. Dan dalam hal itu sekarang memang sudah ada beberapa pembicaraan antara Satgas dengan Bapak Menko dan juga dengan Bapak Mendikbud untuk mempersiapkan hal tersebut. Yang penting tentunya uji coba ini nanti secara bertahap tentu tetap harus memperhatikan 3M tersebut. Jadi protokol kesehatan tetap harus dilaksanakan. Dan nanti kita lihat bagaimana nanti situasinya. Sepertinya akan on off juga sebenarnya terjadi juga di beberapa negara lainnya. Dan kita kebetulan penduduknya sangat banyak. Jadi oleh sebab itu kita bersama-sama dengan Satgas daerah mempersiapkan hal ini. Tentunya juga tidak terburu-buru, tetap prudent. Ya. Terus selesai itu mungkin Pak Moderator.
Baik, terima kasih Pak Dodi untuk jawabannya. Ini sepertinya, it seems like the topic of schools opening up next month is a popular topic, and it's a concern for many of our audience. So we also have this question dedicated to Dr. Suharti. The question is from Irzan Aslam, and it's also about the readiness of Jakarta about opening up schools for offline face-to-face meeting next month. Maybe Ibu Suharti, you can give your thoughts about that.
Oke, terima kasih untuk pertanyaannya. Sekaligus saja menginformasikan bahwa Pemda DKI dalam hal ini Dinas Pendidikan sekarang sedang menyiapkan asesmen untuk kesiapan pembukaan sekolah. Assessment ya, mau dilihat dari kesiapan infrastrukturnya, kemudian juga kesiapan guru siswanya tentunya, dan juga keluarga. Jadi dari hasil assessment ini yang kita harapkan selesai sampai akhir bulan ini, kemudian tentunya akan dikomunikasikan dan berbagai pihak termasuk para ahli, IDAI misalnya, Ikatan Dokter Anak Indonesia, dan yang lainnya. Dari situ kalau sudah asesmennya sudah cukup, akan dipilih hanya terbatas sekali sekolah yang untuk dijadikan piloting. Dan dari pembahasan kemarin dengan para ahli juga kemungkinan piloting juga akan dilakukan khusus untuk sekolah menengah atas. Jadi SMA, SMK mungkin sebagian. Dan itu pun tidak akan dilakukan langsung sekaligus semuanya masuk sekolah, tetapi bergantian masuknya. Dan tentunya harus ada konsens dari orang tua. Jika tidak ada konsen, tentunya kami juga tidak akan berani melakukannya. Intinya adalah bahwa keselamatan warga sekolah termasuk keluarganya itu yang paling utama. Jadi tentunya keputusan apapun nantinya akan diambil, kami pasti akan mempertimbangkannya dengan masa-masa, dengan masukan dari berbagai macam ahli. Itu jawaban dari saya. Mudah-mudahan kalau misalnya vaksin ini sudah bisa dilakukan, kemudian sudah herd immunity sudah ada, sudah lebih aman lagi untuk memastikan anak-anak bisa bersekolah. Karena bagaimanapun juga loss dari pembelajaran yang tidak terjadi ini tentunya cukup besar. Dan untuk menghindari itu, mungkin tadi saya belum cerita ke teman-teman, Jakarta juga karena adanya COVID ini menyediakan cek WiFi. Jadi posisi kemarin 1.200 titik WiFi gratis untuk warga di RW Kumuh kita sediakan. Dengan begitu anak-anak yang berada di kampung Kumuh pun termasuk para UMKM yang ada di wilayah-wilayah Kumuh juga bisa memanfaatkan untuk tetap belajar dan tetap bekerja, dan sudah mulai bisa juga melakukan bisnis secara digital. Itu yang kami kerjakan di Jakarta. Terima kasih.
Okay, terima kasih. Thank you, Dr. Suharti, for your answer. And so moving on to the next question is for Dr. Matsumoto. So this question is from Ibu Mia from Bappenas. Is there any important lessons learned from Vietnam, Myanmar, and other countries in the development of a national urban policy that you think is applicable for Indonesia?
Yes, thank you very much for the question. I think there are many interesting lessons and from different parts of the two studies. I can highlight perhaps two things. One is ministerial coordination. In many Asian ministries, I would say, infrastructure ministry is very powerful ministry, and often we see that the planning ministry is separately established in Asian countries, like Ministry of Planning. In case of Bappenas, also we understand it's a planning and development ministry, but also there is a public work ministry and then other sectoral ministries who are really implementing what is planned in other ministry. So the coordination and also policy coherence across different ministry is a key issue, including financing. So this part, I think what Vietnam is doing or what Myanmar is doing, they are not particularly, I would say, a good example of learning from them, but the challenges that face and how they are trying to address these coordination challenges is very interesting. Second one is actually approach to green recovery or green growth or green or low carbon transition. Again, the country has a different background. But for example, Vietnam was an interesting case where local urban green growth was a very popular topic because people are increasingly, urban people are increasingly interested in air pollution, traffic congestion. So environmental value becomes a very much important key topic in the policy. So government is very much interested in applying green growth concept into their policy, mainstreaming green into urban policy. So this was an interesting case which we can also work with Indonesia. Thank you very much.
Thank you very much, Dr. Matsumoto. Ladies and gentlemen, there has been more questions, actually. Unfortunately, we cannot get to all of the questions. So thank you very much to all of you who have submitted your questions either through the Q&A function within Zoom or through YouTube and other social media in which this is shown. Let me just draw one quick conclusion before I hand this over back to the MC. I really like the framework that Dr. Matsumoto presented in terms of how that the impact, we need to understand that the impact is asymmetrical. This was also mentioned by Professor Roberts in saying that looking at the disability minorities, they are more disproportionately affected than others, and that we need an integrated approach to recovery and that we need a paradigm shift. We also learned from Pak Dodi, from BNPB and Ibu Suharti from the Jakarta government that responsiveness is a key measure for us to be able to respond to and contain the COVID-19 crisis successfully. And that is also what Professor Roberts mentioned, that the capacity of local governments is key. We need to build that capacity, not just in the big cities, for example, like Jakarta, but also in the smaller cities. We need to pay attention to that, so such that the policies that are being taken are evidence-based and can have a better chance of succeeding. Thank you very much for joining the dialogue with our 4 distinguished speakers. We still have the closing remarks, and I will hand over. Please join me in giving a round of applause for our 4 panelists, maybe a virtual round of applause. And thank you very much. And please, MC, take over. Thank you very much.
Baik, terima kasih kepada Bapak Mulya Amri dan Bapak Ibu pembicara yang telah memberikan banyak pengetahuan, dan diskusi ini sangat menarik bahwa tadi disampaikan oleh Bapak Moderator bahwa banyak sekali pertanyaan yang masuk, tapi karena keterbatasan waktu terpaksa tidak semuanya dapat terbahas dengan baik. Tapi kami dari pihak panitia mengucapkan terima kasih sekali juga kepada para pembicara yang telah memberikan banyak pengetahuan tentang penanganan COVID-19. Baik Bapak Ibu sekalian, kita telah ada di penghujung acara, namun sebelumnya kita akan mendengarkan sambutan penutup. Yang pertama akan disampaikan dari Bappenas yang diwakili Ibu Mia Amalia selaku PLT Direktur Pembangunan Daerah Kementerian Perencanaan Pembangunan Nasional Bappenas. Kepada Ibu Mia, kami persilahkan.
Ya, terima kasih banyak Mas Dio. Assalamualaikum warahmatullahi wabarakatuh. Selamat sore Bapak Ibu. Saya ucapkan terima kasih kepada Bapak Nadiem Ahmad, Bapak Profesor Brian Roberts yang sudah bergabung dengan kita, juga Bapak Dodi, Ibu Suharti, terima kasih banyak Bu, Bapak Tadasi, Bapak Karim, Pak Rudi yang tadi sudah harus berpindah ke acara yang lain, dan juga pada Pak Muli, Pak, terima kasih banyak. Juga kepada Bapak Ibu tamu undangan dan hadirin sekalian yang telah menyisihkan waktu di sela-sela kesibukan ini untuk berdiskusi bersama sore ini dalam webinar Indonesia OECD yang mengangkat tema Cities and COVID-19, Indonesia's Response. Selama 2 jam ini yang saya rasa tidak cukup ya ternyata ya untuk mendengarkan semua pemaparan dari para ahli dan juga diskusi dari Bapak Ibu yang tadi sudah secara aktif menyampaikan tanggapan. Kita mempelajari tentang bagaimana pandemi ini yang terjadi di kota-kota kita dan juga perspektif global untuk melihat juga dampak kesehatan, sosial, dan ekonomi, serta juga strategi pemulihannya. Dan yang lebih penting lagi bagaimana kemudian kita harus dapat mendesain kota-kota kita di masa yang akan datang. Berikutnya yang saya pelajari juga adalah tantangan dan pengalaman mengelola krisis di metropolitan dengan arus komuter yang sangat tinggi, permukiman padat, termasuk juga mendesain respons yang tepat dengan data ya. Tadi saya lihat dari Bu Harti sebegitu rinci ya yang sudah dilakukan oleh DKI Jakarta gitu. Saya ingin juga mempelajari lebih jauh apabila Bu Harti memang ada waktu untuk berdiskusi dengan kami. Yang ketiga adalah kolaborasi dalam pembangunan dan pengelolaan perkotaan, termasuk dalam penyediaan ruang terbuka, meningkatkan layanan dasar, dan juga meningkatkan gaya hidup sehat. Yang keempat adalah strategi untuk pemulihan serta ketahanan jangka panjang. Ini juga ada pelajaran penting bagi kita adalah bagaimana cara membangun kota-kota yang lebih baik. Dan tadi juga dari Pak Tadasi sudah menyampaikan bagaimana OECD sudah mendukung di berbagai negara untuk penyusunan kebijakan perkotaan nasional. Dan ini juga mungkin bisa kita lihat gitu ya pembelajarannya tersebut bagaimana ini bisa diterapkan di kota-kota pasca pandemi ini. Semoga informasi dan pengetahuan yang kita dapatkan dalam webinar ini dapat bermanfaat dan dimanfaatkan bersama untuk mendorong percepatan upaya untuk mewujudkan perkotaan yang berkelanjutan. Bagi Bappenas, tentu saja informasi ini akan sangat penting dan akan kami gunakan dalam penyusunan rencana kerja pemerintah 2022 dan juga perbaikan kebijakan perkotaan nasional yang masih berlangsung sampai dengan saat ini. Demikian mungkin yang dapat kami sampaikan. Terima kasih banyak. Wassalamualaikum warahmatullahi wabarakatuh. Saya kembalikan kepada Dio. Terima kasih.
Baik, terima kasih Bu Mia. Untuk selanjutnya juga akan ada closing remarks perwakilan dari OECD yang akan diwakili oleh Senior Counselor OECD Global Relationship Secretariat yang akan diwakili oleh Mr. Karim. Kepada Mr. Karim kami persilahkan.
Many thanks. Good morning, good evening, Deputy Minister Rudi Prawiradinata, Director Ibumia Amalia, Deputy Governor Suarti, Deputy Dodi Rouswandi, and Professor Brian Roberts, distinguished participants, ladies and gentlemen. On behalf of the OECD, I would like to thank you all for this rich and insightful discussion. COVID-19, as we all know, is a global and multifaceted pandemic, with major socio-economic impacts and economic implications. And it has been particularly challenging for large, densely populated cities around the world. From the outset, big metropolises acting as globalization hubs have acted as major transmission channels of the virus. Look at the first few months following the emergence of the virus in Wuhan. Milan, Madrid, Paris, London, New York, Sao Paulo, large economic capitals have been hit hard and fast. This is a major challenge to the model of growth and development driven by global flows of goods, services, people, capital, and data that we have built, in which big connected cities, of course, play a major role. Going forward, this role will, of course, remain critical because of agglomeration effects and the role of cities in nurturing talent. But we must also learn how to better reconcile economic and health resilience. Indonesia is no exception. with Jakarta accounting for the lion's share of cases. Yet the response at different levels of government has been strong and balanced at the same time, allowing economic activities to continue to certain degrees. The challenges of emerging economies must be borne in mind also, as the poorest segments of the population, often working in the informal sector, simply cannot afford to stay at home. At the same time, and as our Secretary General keeps repeating, we must not choose between health and the economy. This is a false choice, since sacrificing health is the best way to delay the return of confidence and the restart of the economy. More and more data and forecasts by the OECD and other institutions show that those who have best managed the sanitary crisis do also record the best economic results. Now, with this said, let me close by putting this event within the broader context of the overall strong and growing cooperation between Indonesia and the OECD. Indonesia has a special relationship with the OECD, being one of its 5 key partners together with Brazil, China, India, and South Africa. Since it became a key partner, Indonesia has actively contributed to addressing common policy challenges and has enriched policy debates at the OECD. Indonesia was the first key partner to sign the framework of cooperation agreement in 2012. This has helped to drive OECD work in Southeast Asia. The launch of the Southeast Asia Regional Program in 2014, together with the creation of a Jakarta representative office in 2015, are testament to this. The cooperation in the G20 context is excellent, and we look forward to supporting Indonesia during its upcoming chairmanship in 2022. This is, of course, an important milestone for Indonesia and a great opportunity to show the very rapid transformation of Southeast Asia and the role it intends to play in global affairs to the rest of the world. Rest assured that you can count on the OECD to assist you in that endeavor. We at the OECD are firm believers in the positive contribution that Southeast Asia can provide to international cooperation. And when I say we, I know that I speak on behalf of both the Secretariat and also member states, all the member states. Everyone wants to strengthen the relationship between the organization and Southeast Asia. We are now in the 3rd joint work program, which was launched in Bali in October 2018 at the margins of the IMF World Bank annual meetings. It is ambitious and comprehensive, featuring many complementarities with the President's structural priorities for the next 4 years. These include infrastructure development, human capital, and investment promotion in the manufacturing sector, development of the digital economy and services. As I enumerate these focus areas, I must confess that it sounds almost like a comprehensive framework for the recovery. Let me also stress the importance of the sustainability dimension, which has been emphasized by Rudy Prawiradinata, and the inclusiveness dimension, as Nadim very well underlined, that within cities, the more deprived areas and people have been disproportionately affected. These issues should be mainstreamed in the course of our cooperation. Finally, the program also includes a part dedicated to fostering effective urban policies and multi-level governance. In this context, we look forward to begin cooperating soon with Bappenas on the planned urban policy review of Indonesia. Let me also emphasize how much we welcome Indonesia's recent interest in getting closer to the OECD. What many of you may not know is that the OECD is also a standard-setting body. Getting closer to the OECD requires progressively joining its many declarations and conventions, thereby gradually building a body of best practices that can help economies and societies make the most of globalization. I am pleased to note that Bappenas has played an important role in favoring Indonesia's convergence with this body of norms, and I am hopeful that this will continue in the future. Former Minister Bambang Brojonegoro signed 2 OECD declarations in Paris at the margins of our Ministerial Council meeting last year, including the declaration related to improving urban and regional policies. Today's webinar is the 3rd of a series to support Indonesia with the unprecedented crisis brought about by the COVID-19 outbreak. Indeed, we have refocused the cooperation this year under the Joint Work Programme to assist the government in assessing the immediate socio-economic impact of the crisis. More virtual sessions are planned in the coming months to zoom in on different aspects of the crisis and ways to address it. Our hope is that such sessions can support a resilient and sustainable recovery from the crisis in Indonesia. The OECD stands side by side with our Indonesian partners in solidarity and support during this unprecedented crisis. You can count on the OECD family. Together, we will work towards building back better as we recover from this crisis. Thank you.
Baik, terima kasih kepada Mr. Karim yang telah menyampaikan closing remarks. Untuk Bapak Ibu pembicara dan yang hadir dalam kegiatan webinar ini, sebelum kita mengakhiri diskusi, kita akan ada foto session. Jadi mohon izin Bapak Ibu untuk menyalakan kamera video. Mungkin akan dibantu dari rekan-rekan panitia. Kita masih menunggu. Baik, apakah masih ada lagi? Oke, silakan. Mohon bantuan rekan-rekan dari panitia. Baik, 3, 2, 1. 3, 2, 1. Baik, terima kasih Bapak Ibu atas partisipasinya dan berbagi cerita, berbagi pengalaman tentang penanganan COVID-nya pada siang hari ini. Dan untuk peserta jangan lupa mengisi absensi, mengisi presensi yang ada di room chat di sistem aplikasi Zoom ini supaya nanti terekam. Jadi nanti akan ada pembagian e-sertifikat untuk para peserta juga yang akan kami kirim melalui email saat yang diisi ketika presensi. Mungkin demikian kegiatan pada hari ini Indonesia OECD Joint Webinar Cities and COVID-19 Indonesian Response. Kami mewakili panitia menyampaikan terima kasih kepada seluruh Bapak Ibu yang telah berkenan hadir dan mohon maaf apabila ada kekurangan ataupun kesalahan dalam penyelenggaraan kegiatan sore ini. Dan informasi selanjutnya disampaikan kepada seluruh peserta mengenai bahan diskusi ini dapat diakses melalui, mungkin mohon bantuan dari panitia, melalui link yang telah disampaikan melalui room chat yang ada di Zoom. Sekali lagi, untuk bahan diskusi dan presensi dapat diisi dan diakses melalui room chat yang ada di Zoom. Baik Bapak Ibu sekalian, terima kasih. Selamat sore dan sampai jumpa pada kesempatan lain. Wassalamualaikum warahmatullahi wabarakatuh.